Hello everybody and welcome to this month's vlogcast. This time we're in Cork and I'm delighted to welcome Clinical Nurse Specialist Avril Gleeson, who is here today actually at the forum. But Avril, I know there have been problems here, well, around the world with COVID-19. How has it impacted your clinics and what is the new normal now that we're out of COVID?
Yes, Nona, I suppose COVID has obviously impacted hugely on our clinics, but thankfully, pre-COVID, we had actually set up a new MPN telephone monitoring clinic, which proved very helpful once COVID kicked in. So in this clinic, we would have had selected patients who would have been suitable for telephone calls as opposed to a physical attendance at clinic. These usually were patients who, with MPNs, be it ET, PV or myelofibrosis, who may not have been able to attend clinic on a very regular basis for various reasons. These reasons could have included, the geographical area from where they're from. They could be travelling 2.5, 3 hours to get to a 5-minute clinic appointment. They may have been quite elderly, found journeys difficult. They may have been nursing home-based residents. So these patients, what we would have done is done a physical attendance at a clinic maybe once or twice a year, and in between do our telephone calls. So these patients would have had their bloods completed in the community by their GP practice, and then once we had the telephone appointment set up, they would receive a letter in the post with an appointment date and time for their call. We would make that call and we would have their blood results in advance of the call, which is brilliant. So you're looking at the patient holistically, you have their blood results in front of you, and then with the telephone call you have the time to speak at length to the patients, and there's not that rush that you would have had in clinic. So having that set up in advance of COVID was brilliant. It made the transition to the virtual appointments a lot easier.
I know that you also run additional support, have groups, or you have additional support for your patients out here. Can you tell me a bit about that? What additional support they have?
Yeah, so I suppose with patients with MPNs, it's such a rare condition, it can be hard to find information. So any of our patients and any patient who's newly diagnosed with us, we would always signpost them to MPN Voice straight away. We would provide the patient information booklets to them. And I suppose some of the patients would like to, interact with another person who has a similar condition, because they are so rare. It's very unlikely you'll meet somebody with the same condition. So thankfully with MPN Voice, you have filled that void for that information need out there. There's the buddy program and there's the online forum as well that people can make contact with other patients through email or phone calls. What else we use as well is we have a psycho-oncology service within the hospital that I work in, and I know it's available in other hospitals also. So that's a service that we have available to our patients with MPNs or their family members or caregivers.
Can you just, psycho-oncology
Yes.
Sounds a really big word.
Yes.
I wonder if you could just say what happens in that.
So it's so basically it's for patients who have a cancer diagnosis, and as we know, MPN falls under that umbrella with the word neoplasm. So this the psycho-oncologist is she's in our hospital. She is available it's a talk therapy to speak with patients or family members about their condition, and it's more about the impact that the condition is having on their well-being, their emotional, their mental well-being. And I know we have referred many patients over the last number of short years that we've had the service available, and they have found it so helpful and useful in managing, I suppose, their reaction to having an MPN and dealing with that.
And one other question, and there's a gap, obviously, for certain patients between their consultations.
Yes.
As a clinical nurse specialist, are they able to contact you if they're worried about something? How does that work?
Of course. So with their information they would get when they're initially diagnosed, my contact details would be on it, and like that, I'm always available at the end of the phone, and I always say if I can't answer the phone, because I will be obviously seeing patients inpatients in the hospital too, to leave a message, and I will return the call. Leave a short message and I will get back, because it's very reassuring to know that there's always somebody at the end of the line if they need somebody to talk through, and it might be just something very, very simple, you know, but it's just to have that little bit of reassurance, you know. And as I say, if I can't answer it, let it with me and I'll try and find out an answer for them.
That must be so reassuring for a newly diagnosed patient. And do you see many younger patients here?
We do. I suppose we have a wide variety of patients. The doctor that I work with, she's a specialist interest in the area of MPN, so we see a lot of patients, and of varying ages, you know. So, and I think that's why it's just nice to have somebody as well like that now, to a contact number, just ring, because when you go to your consultation, there's an awful lot of information given. It can be very overwhelming, and it's only afterwards that you'll start thinking of questions. So again, you know, I'd advise anybody in whatever hospital they attend to always have the contact details of the nurse who's working with that team, so that you can ring at any stage if you have any queries or concerns.
Sounds great. What ambitions do you have as a CNS? How would you like the service to evolve in the next few years?
That's a very good question, Nona. Ideally, I suppose here in Ireland, a lot of the haematology clinical nurse specialists they look after patients with many different haematological diseases. So I suppose ideally, in an ideal world, that you'd specialise in a certain area. So it would be great if you could just focus on MPN patients, and I suppose become, you know, an expert in that area then. I suppose in general we're very spread thinly on the ground, so I think having more haematology nurse specialists, and going forward advanced nurse specialists or practitioners, would be very helpful for the area of MPNs, and especially the patients then.
Because an advanced nurse practitioner can prescribe.
They can, exactly. Yeah, there's certain medications that they can prescribe and manage their own patient group.
This has been a real joy to see you and speak with you today. Thank you very much, Avril.
Thank you very much, Nona, for having me.